Hello, my name is Antonio, and I'll be doing part two of the neurodevelopment of intellectual and developmental disability. This is a very good article that I found. It's about healthcare and the issues that people with IDD are facing. Just kind of similar to how we are facing issues with healthcare, but theirs a little bit more difficult in their dynamic. Um, but important steps are being taken, within the past few years um, that are improving the status of people with intellectual and developmental disabilities, throughout their entire lifespan. Um, they are becoming, more functioning in society, and when they're able to uh, have more confidence and function, their quality of life will be that much more improved. But they also are faced with several challenges. They have significant barriers that really hinder them access to a lot of the normalities that a normal person may have within the healthcare system. Just to name a few, there's a lack of training with healthcare providers. There's communication between providers and the patients. There's the financial aspect of it, I think which that affects us all. But another biggie is just there's a big lack of awareness, from providers to ensure that the IDD community, have access to the appropriate avenues of healthcare that is culturally competent, also with them. Just to give you a little bit of background and history, back in the 1950s and 60s, Dr. Arthur Hopwood said that it's medicine, not education. So they was treating IDD with a medical model. They were termed sick. Institutions were called schools. So it's like they were not getting educated on how to process or how to function with their disability. They were treated more as sick patients and given medication to help them. So it was more like of a custodial type model. But in 1962, President Kennedy's sister, Rosemary, she was believed to have IDD. She created the National Institute of Child Health and Human Development, within the National Institutes of Health. Kennedy's efforts also included efforts to deinstitutionalize people with IDD and move them to the community, and encourage the nation's medical establishment to address the causes and treatments of IDD. Someone has taken a valiant stand to ensure that the IDD community has a voice. For the health status, closing the gap was established by the government, which would want to bridge the gap between deficiencies between or disparities between health care for other people outside of IDD. But the poor outcomes that were experienced by these people were they had poor health with higher rates of preventable mortality, comorbidities, and chronic conditions, and less access to preventive care and health promotions. Once again, financial barriers, even for the insured. Lack of research on healthcare's part. Lack of training on the providers. So there was a lot of outcomes that didn't help them or benefit them in any way. But in 2006, the American Association of Intellectual and Developmental Disabilities, they said that, hey, let's ease up. Let's think about this. So, Article 25 of the convention, outlined that people with disabilities have rights. They have the same range, quality, and standard of free and affordable health care as providers or other persons. They have the same care of quality, the basis of free and informed consent by raising awareness of the human rights, dignity, autonomy, and needs of persons with disabilities through training and promulgation of ethical standards for public and private health care, and the provision of health insurance and life insurance where such insurance is permitted by national law, which shall be provided in a fair and reasonable manner. So once again, big strides have been taken, to ensure that this community, that the IDD community, is being well spoken and being in the forefront in healthcare as it continues to grow in America today. Here is what the IDD patient or individual may experience as the type of care that they need. It's not too different than what you and I may experience, just like a few things. But other than that, it's just we all face this, with them, a little bit more than we are. So you can just see, all the things that needs to be worked on. So even though there's things in place now, still a lot of work ahead. But with new models coming on, they were derived from 5 different, 5 core objectives. They want to increase availability of integrated health care. They want to improve quality of care among community health care providers, develop the health promotion resources for people with IDD. They want to increase awareness of healthcare needs among people with IDD and develop a healthcare delivery system model tailored to the needs of people with IDD. So these are some new concepts that they are working on and moving forward with, in the decades and in the years to come. Alright, here's a few websites that I chose. They're very good, very informative websites. The ARC is very good. It's specifically for people with IDD. They have blogs, things for parents. You can sign up for newsletters. It's for everyone. Have a place for lawyers, friends, family, anybody who would like to know more about learning disabilities can go to this website. Now, the AAIDD website, they have a lot of forums where you can go on webinars, see conferences. You can see who are promoting and facilitating and policy changes, the rights for people with IDD. Now, the Special Olympics is another good one too. Is giving this community, people with developmental disorders, a chance to be champions in their own lives, to give them more confidence and to build relationships. Very good website. It's millions of people participate, millions of people who are volunteer. You can go here, you can donate, you can help be a voice, you can help out. So all these websites are very good and very informative. So I encourage you to look at these websites, just be a voice for the community. Thank you.